Okay, so this video is going to be high-yield seizure medications for the FNP. Seizure medications are complicated and not going to be given by you, so they aren't something that you're going to know really offhand. However, they are super important because when your patient comes in with them, there are so many side effects. And these are the ones that you really need to know about. So dilantin, or phenytoin, is commonly known as. It's going to be the most common one that you're going to really need to know about. That medication is for clonic tonic seizures and parietal seizures. Clonic tonic is going to be no consciousness of the patient and they are jerking around on the floor, falling, all these kinds of things. This is kind of the grand seizure, the seizure that everybody knows about. The partial seizure is one that starts in one area and kind of goes to different areas of the brain. This is going to have some arm and leg movements that are abnormal. However, the patient is still conscious. Absence seizures are seizures where your patient is staring a lot, and they're more common in children. Dilantin is going to be a medication that does not treat the absence seizure, so that's important to know. With that, when you see dilantin, you're talking about your patient is actually having involuntary movements with or without the loss of consciousness. So it is very important to treat those, I guess I would add. A lot of the seizure medications have narrow therapeutic indexes. So these are not all medications that are for seizures, but I mean, good to know. The ones that we're really looking at today are Carbamazepine and also Phenytoin. So both of these two are going to have a very narrow index. When should you suspect that your patient needs dilantin levels tested? You can test in your office for dilantin levels and have them sent to the neurologist if there's some reason why you think that a dilantin level should be tested. Basically, that's going to be when you think that your patient has come in and has toxicity. If you think for some reason they're having side effects that are concerning and have to do with some neurological symptoms, you can go ahead and test a dilantin level. They are also going to be taken when you start the patient on Phenytoin/dilantin. When you think that they're not taking their medication because they're having seizures, or if they're having seizures and you want to know what is the actual level in this patient's blood. And then when you adjust it, obviously, within about a week, you're going to want to do a trough level, which is 8 hours after the dose. So, dosing. Patients on dilantin/phenytoin should be getting 3 to 8 milligrams per kilogram. And then the therapeutic range is 10 to 20. These medications come in 100 milligrams, 30 milligrams, and 50 milligrams, or they also come in an oral suspension, which is super common, especially for kids. Getting back to carbamazepine, you cannot take that with birth control. This is because they both use the same receptors, the CPYK receptors. Now, this is probably why we don't see it as much as we see dilantin, because it disturbs the oral contraceptives so much. You, as the family nurse practitioner, might be the one prescribing the oral contraceptives. So if you see carbamazepine as one of your patient's medications, you're going to go ahead and say no, that this you can't have both. You should expect to get pregnant if you have that. This is a big need to know item because I think that if you're pregnant, your patient becomes pregnant after you put them on an oral contraceptive, they're going to be really upset with you. Okay, so of note, these two medications, carbamazepine and also dilantin, these are the trade names of carbamazepine, by the way. I thought that would be helpful. They're both protein binding drugs, which means that if we have both of them at the same time, they are going to be 40% less effective. This is probably not as much as the need to know thing for you, the family nurse practitioner, because the neurologist should be looking out for this and giving both at the same time. But if you happen to find this out from your patient, that would be a great piece of information to pass along. Or ask them to go see their neurologist and let them know about that. Okay, so I hope that was a great quick review. The medications that the FNP would need to know related to seizures.